Can you believe it has been 1 year since my hip replacement in February that started this whole giant playlist that I had no idea was going to include so many videos? So, what started as what was going to be a solution to my hip problems with a hip replacement that people had reassured me they happen all the time, they're a dime a dozen, they're one of the easiest surgeries to recover from, has led to 366 days of craziness. So I wanted to just capture the whole year and give an update as to what's going on with my hip currently, 1 year post hip replacement. The biggest thing that I want to talk about is what's helpful and what's not helpful. And then I'll finish with the biggest lessons that I learned. So, the things that I found to be helpful when going through a hip replacement and the people on the outside. I mean, we have all the practical stuff that we know the surgeon gives us, the PT gives us, the practical things like grabbers and toilet seats and precautions. But the things that we need, or at least what I need from other people, is simply to say, I am so sorry. Those three words, maybe not so, but I am sorry, goes so far in somebody who's struggling with pain, struggling with recovery, than saying, you'll be fine, tomorrow will be better. So it's helpful if you have a loved one or you're going through this to advocate for yourself, for the people around you to simply say, I am sorry. Another thing that is super helpful is when people say, what can I do for you? How can I help you? Instead of interjecting opinions and you need to do this and you need to do that, how can I help you? And then the third thing that I found through this year is when people ask questions, and not questions like, why did you pick that surgeon? Or what are you doing wrong? But just to ask, how are you feeling? What are you doing to find joy today? What makes you happy? Like, we need as human beings to have a better intimate connection with people, especially when people are going through challenges. So those are the helpful things. Simply saying, I am so sorry. How can I help you? And then asking questions. What is not helpful? And I have gone on tangents about this. What is not helpful is blaming the surgeon, blaming the hospital, blaming the patient. You must be doing something wrong. Boy, your body is so screwed up. That is not helpful. That is so not helpful. Comparing, having comparison come into a conversation, or even myself, comparing myself with somebody else's recovery. That's not helpful. It's not helpful to think that we should be suing the hospital, suing the doctor. That's not helpful. It is not helpful. Nobody is at fault in my situation. Nobody is at fault. Another thing that is not helpful is just the negativity that comes when people want to blame or shame or accuse or question. That's just toxic. It is so toxic. And that's not helpful for somebody who's very deliberately working on staying positive, staying hopeful. And then when people say, you'll be fine, or, oh, my mom went through it, it's no big deal. I was walking in 3 weeks with no cane. All of those opinions are so not helpful. They're not helpful. If anything, for me, it triggers unworthiness, it triggers failure. And maybe I got to work on that, and I'm willing to. But I just hope that through this year and this playlist of mindfully recovering, there's a difference between simply recovering from hip surgery or any surgery and doing it mindfully. And I hope that I have brought insight to how to do it mindfully. And what's not mindful is dismissing somebody's legitimate, valid feelings as a form of comparison or opinions or expertise or blame or shame. That's not helpful. To be mindful with someone who's going through challenges means you sit with their pain and you acknowledge their pain and you acknowledge their fears and you ask questions and you get curious about the individual as a whole, not just trying to solve a problem for that person. So the lessons that I've learned in the 365 days that I walked into the operating room, into the hospital with a big hope that the hip replacement was going to solve my problems. Prior to the hip replacement, I had 3 labrum revisions. So I had gone into hip replacement last February 5th, already having 3 surgeries on my left hip. The hope and intention from my very skilled, compassionate, wonderful surgeon was that this was going to eliminate the pain. And by April, I needed a revision because there was the suspicion of a hematoma or infection. Lo and behold, there was a bacteria growing inside my body that was needed to be treated. The complications from the treatment of the antibiotics was horrific. Endured that, got through it. Summer started to show a little hope, and by August, something was going wrong. And if you followed along through the fall, I started to develop an enormous amount of swelling in my leg that required a second revision that I had just 6 weeks ago in December, the late part of December. I had a revision. The tissue was cultured. Everything showed up negative for the bacteria. So the capsule had popped, like the cocoon that encases our joint, popped open, and the synovial fluid was dumping into my leg. That's the simplest way to explain it. So he re-sewed the capsule together. He used heavy duty sutures. He pulled it as tight as he could, sealed up the capsule. At week 3, just 3 weeks ago, as I was sitting on ice, being very careful, having all the precautions of a total hip replacement, both anterior and posterior. So if you've gone through this, you know there's no crossing your legs, there's no bending, there's no swinging your leg back, swinging it open. There's absolutely neutral with your hip. And I had adhered to those precautions overly. I was so careful and so careful. In fact, I didn't even attempt to go up and down stairs until the 2.5, 3 week mark. But I got up one day around the 3 week mark and noticed there was a pocket of fluid building. That pocket of fluid has since grown to enormous amounts, which led me to my surgeon, which led me to an MRI last weekend. And the results of the MRI is that the joint capsule has popped open again. And the IT band that runs from your knee to your hip, because of the pressure of the fluid coming from inside the hip that popped the capsule, it has popped the IT band, which is unbelievable because the IT band is a very thick, dense material in our body, and the pressure from the fluid. So, how am I having all this fluid is the question. And so today I'm going for testing for infection to see if it is indeed infected again. If it's not infected, in 2 weeks, he's going to create a graft to make a capsule to contain that fluid and keep my hip joint, my implant stable. Without a joint capsule, we run a risk of dislocation, looseness, all of that. So it's been a year. That means in a year and a couple of weeks, I will have had 4 surgeries on my left hip, in addition to the 3 prior. So when people say, you'll be fine, that's not helpful. That's not helpful. Because at this point, I don't know that I'll be fine. So let's go to the lessons. The lessons that I've learned this year is every single day, find joy. Whatever that joy is. If it is brewing your favorite coffee, that's your joy. If it is looking out the window and noticing birds, that's your joy. If it's learning a new skill, like I learned how to master sourdough through this year, like master it. That brings me joy. Being outside when it's warm, sitting in the sun is joy. All of the things that we might have taken for granted when we're busy doing our busy lives and all that goes when we think we're on autopilot in our life and something happens and we are asked to stop, we are forced to stop. And the joy that I had before my hip surgery was a very active joy. And so I had to mindfully find different ways to find joy, to seek out joy on a daily basis. And that is what this whole playlist, this whole journey on YouTube is about, is mindful recovery. I had to be deliberate with how I found joy because what I used to do was no longer available. The second huge lesson that I've learned, that as a very strong, independent woman who raised three kiddos by themselves, who has a disabled daughter, who advocated crazy amounts of her life to benefit people with disabilities, a giver, a giver, a giver, I had to ask for help. I had to learn to ask for help and receive help. When people offered to help me, I had to learn, which was really hard, to say yes. As somebody who always wants to forge through life on their own, I don't want to be dependent on anybody. I don't need anybody. I don't want anybody. I've learned I need people. I need help. I need people. I need love. I need comfort. I need friendship. I need things brought to me. I need somebody to put my socks on. So, learning to ask for help, receiving the help that is offered. My instant response when somebody offers to do something for me is, no, I'm good. No, I'm good. So not only do I have to learn to ask for help, I need to receive help. And so I'm learning to say yes. Sure, that sounds great. I'd love that. It's so hard for me. And then the final lesson that I have learned through these 365 days is to pause. And it's something that I have taught for 17 years in my yoga teaching, is to pause. And the pause means we don't have the automatic response. We don't react in the way that we've been conditioned to react our whole life. I'm good. No, I'm fine. I'm strong. And we put this armor up in front of us. But when we learn to pause, the armor flips away and we are able to actually access a part of us that maybe we didn't even know existed. We're able to reflect, respond deliberately and mindfully. And so there's beauty in the pause. And this has been a huge pause in my life. My life prior to my hip surgery in February 2024 was teaching adaptive yoga in over 50 assisted living homes, constantly outputting, giving, serving, helping, assisting, loving, hand holding, massaging, rubbing feet, all of it. And then all of a sudden that comes to a halt. Last spring, I was able to reintroduce myself into about 30 homes. I got to go back for a short period, I think 2 months before my hip exploded. And so the pause has asked me and invited me to reflect on what will be going forward. Will I be able to go back into assisted living and work with people who are paralyzed and use my physical strength to move somebody's body? Will I be able to energetically love on a young person who's facing frontal lobe dementia and no longer knows his children? Am I going to be able to do that? The pause has asked me to reflect on my life and what brings me joy. Absolutely, assisted living, adaptive yoga brings me joy. It is what I believe I am here to do. So with the pause, I have to think, how can I adjust that dial? How can I turn it to where I'm still serving? I'm still giving what I believe I'm here to give, but maybe in a different way. So I'm looking at public speaking and mentoring and teaching other yoga teachers how to do this, or other people that have huge hearts how to do what I do. And so turning the dial might mean that I'm not in front of the people who are living in assisted living, but rather I'm educating people how to do it. I don't know, but that's what I've learned. I've learned Joy is primary. And maybe that means letting people in your life go that don't bring joy to your life. It's putting up, I hate the word boundaries, but I would rather say I have margins and I've decided what goes in the margins versus I have boundaries against out. I don't like boundaries because it pushes people away, but margins is you putting into your life what feeds you. And that is something that I've worked on this year is recognizing that there are certain situations and people in my life that don't feed me, that don't belong in the margins. So, what brings me joy? Asking and receiving help and pausing. There's a bird right outside my window, a little finch. I could miss all of that. But if I choose to be mindful and I choose to pause and I choose to sit and be still, I'll notice all those things. All right, so that's it. If you're going through this, figure out for yourself what's helpful and what's not helpful. Maybe our list will cross over and you'll say, yeah, I agree with you. That's not helpful. And maybe you won't. And that's okay. And 99.9% of the people who have watched my videos this year have been incredibly supportive, coming from a place of love and compassion and a heart. And I so appreciate it. There's been a handful of people that have responded to my videos with, get over it. Get over it. We're sick of hearing about your hip. Or why are you putting fear into people? Why are you scaring people? And that's not my intention. My intention is to shed light that not everybody has a great recovery, and that as human beings walking the planet together, we have to do a better job. We have to be compassionate. We have to stop interjecting and making people feel like there's something wrong when it doesn't happen the way you think it should happen or it has happened to you. And so I'm not trying to put opinions of what you need to do in your recovery because it's ultimately yours. And I'm just offering mindfulness as you navigate your own recovery. How can you be mindful about bringing what brings you joy into your daily life? How can you make sure that you are supported and loved and graced with the best possible healing that you can have? That's my intention. So thank you for joining me on the year. My year's not over. My journey's not over. I'll be facing surgery number 7 on the same hip in 2 weeks to reconstruct my joint capsule, or I will be facing complete removal of my implant and battling an infection. So stay tuned, hang in there with me. I really appreciate you listening and learning and giving me feedback and comments and messages and love. It is unbelievable. So I receive it. I receive it all. I don't receive the nonsense and the naysayers and the negatives. Don't receive that. That's not in my margins. All right. Have a beautiful day. I'll be in touch. Thanks for hanging in there with me. Take care. Bye.